How's it going, Dr. Lee?
It's going. How are you doing, Paul? Good morning.
Good, good. Hey, first of all, we want to thank all the viewers, all the followers that are watching these videos, that are wanting to get. I mean, the idea here is to have a little bit of more long form content, stuff that, you know, takes a little bit of longer time to explain because you can only put so much on an Instagram reel or an Instagram post.
Right, correct.
So we want to thank all the viewers, new and the ones that come back that are actually interested in kind of learning about your business, your company, what it is, who you are, and what you do.
Yes,
So
thank you, everyone. So
thank,
we really
thank
appreciate
you.
you joining us today.
Thanks, guys. So today, this is going to be our second podcast. We're going to what is holistic veterinary medicine, Dr. Lee? If you can explain that to us.
Sure. Yes, let's start with the basics. So basically, holistic veterinary medicine, it's a style of medicine where the doctor usually takes a little bit more of a natural approach to healing. What we mean by this is that it involves a little bit more of a wholesome, comprehensive view of your pet's health. We consider not just like their physical symptoms, but also their emotional and environmental well-being. So that's kind of the way that we differentiate from your conventional style of practicing medicine, where usually that's going to be more of a mainstream type of medicine, where you're going to be incorporating more of those pharmaceuticals and surgery, radiation, and things like that to treat various diseases.
What what is it about this holistic method, this holistic approach, um, that kind of like made it like what you do today? What were you doing before this? Why did you choose this now, essentially?
Yeah, for sure. So basically, during my clinical rotations, I kind of had an idea that I felt passionate about this type of medicine because during that time, I was able to really experience different externships and I was able to get into some integrative rotations. And that's kind of where I was able to kind of dip my feet into that style of practice. And so I always kind of had that passion for it, but it was really one of those things where, as a new grad, you don't know that much. You go obviously through the 4 years of education. Your last year is more of like a clinical rotation where you're finally getting a little bit more of your hands-on skills. But it's still fairly new. And so I knew that I wanted to have like a really good mentorship and go into a hospital where there would be about 8 to 10 doctors. I would be able to throw off ideas and really just learn from them. So I did go into practice as a conventional general practitioner. And I do think that that was probably the best thing that I could have done for myself because it really did give me the foundation that I needed to become an expert in the field. And the confidence that I would have to be able to, not just be comfortable with like your basic things with, surgeries, anesthesia, being able to treat and prevent diseases through formal diagnostics and tests, and then also just be able to know the standardized treatments as far as conventional medicine goes. And then from there, it was interesting. It was a little bit of a learning curve because once I became really good at that, then I started also kind of, it's like I had forgotten a little bit about holistic medicine when I became a practitioner. I did it for so long, about 4 years or so, that I was happy with what I was doing. But then all of a sudden, I started realizing that with conventional medicine, as amazing as it is and all the benefits that it can have, I did find myself having some limitations on the treatments. And in ultimate, that's kind of what started again firing my passion for integrative medicine.
Why is that? Why is that? I mean, why don't more conventionally, known veterinary doctors go or kind of recommend holistic approaches?
I think it's because with conventional medicine, it's so strongly science-based that, we go through the whole process of trying to make sure that we have the journals and the research behind it, that we kind of forget about the foundation of the things that got us there too, right? So all these medications and pharmaceutical drugs are kind of miraculously, because they do work really well for what we want them. But it is unfortunate that because of that, sometimes we get those side effects that come with it. And so I guess we're kind of so focused on that. And then the fact, Western medicine is amazing as far as like we save lives with surgeries and things like that. They're a little bit more invasive. And so um, I don't know, I'm not too sure why we kind of have gotten away from just the basics of, how medicine started with, back in the day, we started just, thinking, okay, what are we eating? How is that affecting us? And then dabbing into herbs and fungus and things like that, and then learning from them. And so we've developed them and we've come so ahead that I feel like it's hard for us to sometimes go back to those basics.
And it feels like, in a sense, like you can see that reflection with people. And in the past 20 or so years, coming back to a more basic approach, what are we putting in our bodies? What's our mental state like? What's our physical state like? All of these stress factors and things like that, our environmental factors and things like that. We've been more and more, I think, in general, as a whole society, learning more and more, excuse me, over the last 20 years. I think that in a sense that's what a lot of people are applying to and starting to see in the creatures that we call companions, in our dogs and our cats and our birds and lizards, snakes, whatever it is, right?
Right. I mean, it's exciting, right? All these technological advances and how far we've gotten as humans with medicine. It's amazing. And so I think, we get so excited with that. And then we kind of sometimes, forget again. And then now, though, it's like we have so many complex things going on that we're starting to think, okay, wait a minute, like, okay, some of these basic things are things that we could probably do at home without having to, go see a doctor, things like that.
Right. I mean, I think that, definitely a traditional veterinary doctor, as most people know it, is the one where you go to the ERs, an emergency happens, or you go get your basic checkup and shots, things like that. But there's a whole different other aspect that I just feel that there's probably not the bandwidth for there to be, like, for that side to kind of like really take control of it, although it is absolutely necessary. And I mean, at the end of the day, those hospitals save lives, those doctors save lives, and all these things, right?
Yeah, definitely. And I think that's where I guess it's important. I guess as the practitioner, for me, it's been one of those things where I really always consider myself what we call an integrative doctor. So again, I still believe in my conventional Western style of medicine. I still also strongly believe in my Eastern holistic style of medicine. And I think it's all about balance, right? And balancing, you never want too much more of one or the other. And so dabbing into both of those fields, there's that sweet spot. And I think it's perfect that, to be able to use both.
Right. And for our listeners, we don't really ever have, this isn't like a scripted show, right? Like, we're definitely not, we do have topics for each episode, but it's definitely, we're just kind of having a conversation. It's more conversational kind of topic-based discussion that we're having. But we'll reel it back into more of what it is you do and focus on. We'll go ahead and let me go ahead and ask you, what is it specifically that you do what's your day-to-day as a holistic veterinary doctor? What treatments do you do? What patients do you see?
Okay, yeah. So I offer a more natural, less invasive style of treatment. My way of practicing, my mobile practice, is that I'm more of like a referral style based doctor. And so again, because I still strongly believe in conventional medicine, but I don't have a brick and mortar, I don't have the access to be able to do these diagnostic tests, practice surgery, do all those other things that I still believe strongly in. So when you first start to see me, I usually recommend, that you still keep a relationship with your conventional doctor or your primary doctor, because most of the time they'll find me once they've already been with the doctor long term. And use basically, I come in as a little bit of a supplemental. And so, I come to your home. It makes it more comfortable for your pet. In those instances, because they're not as stressed, I'm able to really get an idea of, what their environment looks like, how they actually behave without feeling like they're going to be poked and prodded at the hospital setting, because once they get there, or even once they get in the car and they know that they're going to the clinic, they're amazing. They know, and so they start freaking out, and they completely yeah.
Somehow they know it's not going to be a park trip.
Yeah,
I think as soon as that you miss the park turn,
right. They're like, wait a minute. So again, they're comfortable. We sit down, we really get to talk about, all the things that are not just, your primary concerns as far as like their symptoms at that point, but things that have been happening throughout their lifestyle and changes and things like that. It's nice because I'm able to also really go through, what they're eating at home, if they have any siblings there, as far as like, pet siblings. And really just kind of do a full, really comprehensive exam as far as that goes. From there, then I basically will offer a few different alternative modalities. So some of the things that I offer are like your acupuncture, your herbal therapy, food therapy consultations. We talk about supplements. We talk about nutraceuticals. We talk about pulse electric magnetic field therapies. We have laser therapy also involved. I also always recommend, like chiropractic work, physical therapy, which I don't offer those two things, but those are two other modalities that are also considered in the holistic approach to medicine. So that's kind of what we do. And then, I continue coming in and seeing them, and then work along their vet as well too, to support them.
let me ask you, because a lot of your followers on Instagram really love the goggles
Yeah,
and
the goggles.
and the laser therapy and the laser treatment, and I think obviously they really love the acupuncture. So can you just briefly describe what those treatments are and how they benefit the pet?
Sure. Yeah. So acupuncture, again, that's been here for thousands of years. The Chinese basically perfected this treatment modality based off of what we call our meridian channels. And so basically, acupuncture points are they're sterile needles that are placed in these meridian channels that are kind of like a road map in your body. And so based off of like different theories, which are like your five elements, your yin and yang, things like that. We can probably get really deep into it, but I'll just do like a really brief explanation. These kind of help figure out where the meridian channels lay in the body. And so based off of that, you're able to really put points that are going to benefit things depending on what's going on with your pet. So not only can acupuncture help for your most basic things that people like will think of for acupuncture, so pain management, right? More of like orthopedic issues, neurological disorders, but it also really helps with any like stress or anxiety, allergies, internal disorders like chronic kidney disease, liver disease, heart disease. So it's really amazing because there's really no limitations to what disease processes acupuncture can help in. So that's what's so amazing about it. And I feel like that's why it's really like my main tool when it comes to my treatments, as far as when I come over to your house to do, a session. Laser therapy, that is a little bit more for like your orthopedic physical therapy type of cases. You can use it for like, let's say your dog has an ear infection. There's a setting for that. There's internal settings too if you need help with like any pain management with abdominal disorders. It's really great for like wound healing, but basically laser therapy, what it does, it's what we call photobiomodulation. So it's basically sending these like heat waves that at a certain frequency and strength that are going to target your tissues and at a cellular level. So they affect your mitochondria, and they kind of help regenerate these cells. And so same with pulse electric magnetic field, it's kind of like the same concept. So all of these three modalities, again, they're going to help with like pain management, inflammation, just bring in all those good white blood cells, increase circulation, things like that. So overall, great.
And this can be even used in combination with probably, or you can even probably eliminate the use of chronic, like drug use, prescription, or
Yeah, definitely. So that is one of the things where I do have a lot of my patients and clients that come to me where, their dog has been on what we call carprofen, which is the generic name for like a non-steroidal anti-inflammatory, which long-term use of it can affect the kidneys. And so a lot of these other drugs, even more severe ones like opioids, like tramadol, buprenorphine, things like that. Again, they work really well. But again, if your pet needs to be on it long term, sometimes it's not the best to keep them on that, especially like steroids. So then that's when, yeah, these alternative modalities are great because it does allow us to basically taper them off of these other pharmaceutical drugs and then have a more natural, less invasive approach to healing.
what else? I mean, I think that covers it, Dr. Lee. You kind of, I think that we got, pretty honed in on what it is that you do on this episode. And if anybody has any questions, shoot us a DM or a comment on Instagram. We're obviously on YouTube, Facebook. We're on TikTok. So let us know if you guys have. Yeah, come find us and let us know if you guys are, interested in any certain topics, have any kind of general questions. And we would like to thank anybody and everybody that has made it this far and watching this this episode.
Yes, tap out after.
So thank you, Dr. Lee. We'll go ahead and end it there for today, and we'll see everybody next time.
Sounds good. Thanks, Paul. Talk to you later.
Thank you. Bye.
Bye.